Hi, everyone, and welcome to the special simulcast, the Neil Haley Show and the Cutting Edge Benefits Podcast with our host, Tom Quigley of Claim Links. All right, Tom, our topic today is one that what happens when hospital bills or large doctor bills come at you and you didn't have the coverage, there's a deductible or you owe a certain amount of money. What should you do? So we'll talk about that. This is the one thing they think that, if I have this bill, I'm just in debt for life. And a lot of people run up hospital bills, don't they?
Well, they do, but they don't realize it's all negotiable.
Yeah, let's talk about, it's negotiable and understand that is what happens when those increase. Like let's say you go to a trip to the emergency room and you paid that deductible or you paid like the copay and you're thinking, I don't like to owe that much. And then the insurance company comes back and say, you owe this. What should you
Mhm.
do instead of hearing those phone calls all the time from the hospital?
Well, here's what I did. This happened to me. I actually went to the emergency room and it took them about a year to submit it to my insurance company. And I had already paid $300 for the doctor, and they came back and they wanted me to pay them $1,500 more and 2,500 a bill. And so the insurance negotiated it down. And I told them I was there an hour. I hurt my neck, and they put a ice pack and an IV in me, and the doctor saw me for 10 seconds. And I was like, I'm not paying you $1,500. Sorry, that's you guys are just ripping off the consumers. Um, the doctors are great, but the administration should not be making more than the doctors because they're corrupt. So I told them this, and I said I'm not paying it. So they sent me to collections, which is even funnier. So finally, this week they called me. I go, okay, hey, I'm not paying 1,500 and like $60. So they came back and they said, well, we'll knock it down to like 1,100 or 1,200. I said, I'm not paying that either. So they got down to like 999, $1,000. I said,
Right.
okay, I'll pay it, but I knocked $600 off just by doing that. It, if you want them to send it to collections, all these people are like, it's going to screw my credit up. Yeah, my credit score went up like 780 to 800 right now. So I don't know what they're talking about when I hear that. It's like they don't report you to the credit bureau because the credit bureau, I don't even think, they don't even believe them because it's all fictitious numbers they make up. So I'm sitting there going, yeah. So the first step is we're not paying anything. Um, Throw away the first four bills. And when you get a phone call, you say to them, you want an itemized bill of what they're charging you. And that will take them a couple weeks. And then they call you back and you tell them, yeah, I'm not paying this. This is outrageous. Um, and they'll come back with better numbers. Also ask about the patient assistant programs that you're eligible for in some cases that will forgive the whole hospital bill totally. I had one lady in New Hampshire during COVID. She went into the hospital and there was a grant that paid for all your out of pocket. She had a minimal essential coverage plan and they said she owed them 60,000. So they got me involved, and all I said to the hospital administrator was, did you apply to the Health and Human Services loan? And they said no. And I said, well, you need to. They did, and they forgave the whole 60,000. I had another friend in Maine. Went to the hospital. He had VA benefits and he had a heart issue. And he went and it was an emergency and the VA covers that, but they didn't even submit it to the VA. So when I told him I was gonna put him on my podcast, they mysteriously came back and gave him 48,000 back and forgave all the rest of the debt and apologized for not filing to the VA.
Amazing. That's the power of it, right? They get nervous and then they're going to do it. So you should definitely stand up to these bills.
Yeah, I mean, you don't pay attention for the first, I mean, 6 months. When they start threatening collections, you have two choices. One, okay, you want an itemized bill, and then you pick it apart. You're like, I'm not paying $200 for an aspirin. Screw you. And then if you threaten, like I always say, I'll have you on my podcast to explain why you're so corrupt and mysterious. Or, when they realize that you might go to the media on this, they mysteriously come back with better deals. You've got to be willing to do that, though, or you just pay the ridiculous amounts out of pocket and complain, or you can do something about it. I do things. I have people call me routinely, friends, family. They go, "Hey, Tom, will you negotiate this?" Sure. First
And
step
when
is
you when you yeah,
how many
how do
bills have
you
you got?
yeah. So let's talk about the negotiation process. You call them
Yeah,
up, tell me what you do.
it's Tom Quigley, and the clients with me the first time, and they say, "Hey, I give Tom permission to talk on my behalf." So I say to them, I go, "We need an itemized bill." Great. Get the itemized bill. I start picking it apart, and then I ask them about their patient assistance programs. What percent of federal poverty level do you need to be at with your program? Some go up to 600%. So that's the next step. Um, then I turn around and they send the itemized bill, and I say, there's no way in hell they're paying $3,000 to, for this, and this. You need to come down and be realistic. You're charging. I mean, this is just highway robbery. What are you
Mhm.
doing here?
Right.
And then they come down, they give a number. So or you can put your money in a health savings account and let them drip it over 3, 4 years with zero interest. It's not really up to you. You don't get as, and then you constantly say, what will you accept as payment in full? And they will come back and they'll tell you. And if you don't like that number, keep giving them $50 a month. Or the other, you got to be willing to make them think they're not going to get any money. Another good one is, hey, I think I'm going to have to claim bankruptcy.
Mm.
Yeah. And then I say, what's 100% of nothing when your other 20 cents versus nothing? See, there's all kinds of ways to do it. So if you don't have insurance, you can negotiate that way. And usually there's more grants without insurance. The whole system's a scam.
Right.
So what you have to do is you got to understand it. So I do, and so people they call me up, they go, "Tom, what can you do here?" And I'm like, what's occurred? Give me your story. Everyone has a sad story.
And then you go do it. And so you call on their behalf or but
They
call.
first call, they're on it, giving me permission to speak on their behalf, blah blah blah. Sometimes they have to sign a HIPAA release form, and then I sit there and I negotiate with them. And the girl, like yesterday, I had one down in Texas, and I talked to the my staff was having trouble, so I got the head honcho there, and I won't name names, but I told the hospital that, hey, do you take Medicare? And they said, yeah. And I said, so somebody has a individual plan, you get paid more than Medicare, and you won't take it. You guys are so greedy. I go, you need to be on my podcast with Neil to explain to America why you're screwing everyone, and you guys make more money than the doctors who save lives. What do you guys do? You greedy bastards. Get them out of here. So they get all frazzled because no one talks to them that way because people are afraid of them, like the IRS. They're easy to talk to too. You set up payment plans or whatever. So it's like, okay. So in this particular case, they wanted the lady to fund $10,000. And I'm like, she has primary and secondary insurance. What are you doing? So they came to my way of thinking and didn't charge the 10,000.
There you go.
Yeah.
That's simple. And why would they? So the $10,000 is just based on poor building, or
The primary had out, she's out of network, and there was a PPO kind of plan, point of service they call it.
and they know
And
you're not going to give them the money unless you negotiate. They stop because do they get bonuses for this? The people that are negotiating these things, or it's just part of their job
well,
description.
there's a lot of companies who negotiate and charge, savings fees, but the way I look at it is if they're clients of mine, then I'm working on savings, so that prevents the employer from having to pay out, and it helps the employee too because they get to pay less. So yeah, those are things you take advantage of. You got to have a certain dollar amount, the $200, $300 bills you're complaining about at the, come on, be real. The doctors and the urgent care you don't negotiate with. You're negotiating with the hospitals. They're the criminals here. And, quite frankly, um, they charge you all these outrageous, they inflate the pharmacy, they inflate the labs, they inflate everything. Just like last week, the direct primary care, we're talking about how you go to direct primary care and the laboratories
Yeah,
are the one company was paying 1.2 million using LabCorp, and he uses LabCorp, and his would have been 46,000 because LabCorp charges the same amount. It's just their middlemen inflate the rates. Same
right.
shit with the hospital, different day. So the hospitals, all they're doing is taking advantage of consumers who are uneducated, and they give you all this convoluted stuff that you have no idea. And so I know what to ask for, and I know what to do, and I take advantage. And a guy in my office, we should have him on our show actually, Bill Tillman. He's excellent, one of the best I've seen it dealing with these hospitals. He's great. You got to have a special personality to deal with these folks. You got to be able to make them smile, so to speak.
Because and when you're on the phone, you always got to be able to know you're going to win. Because if you don't, you're going to lose and come up with that dollar amount. But you're saying it has to be a certain dollar amount. You negotiate that and then say, I don't have that much money. I'm bankruptcy. Can I get in a payment plan? So you say, okay, we negotiate 600 or 800. Then you say, I'll make $100 payments for 8 months or $50 payments
Well, and
for,
then yeah, and then the hospital. I mean, honestly, you should ask the hospital one thing: do you accept Medicare? When they tell you they do, all the other plans, even reference-based pricing, all of them pay more than what Medicare pays. So it's like, why aren't you taking everything? Why are you causing problems for the consumers saying you're not in networks? You're crying, but yet you take Medicare, which is the lowest cost reimbursement there is. So how do you justify these companies are giving you 100% above Medicare and you're crying because some of them, the groups are paying 300% above what the government says they should be paying. And they're saying, well, we can't make it with Medicare rates. And it's like, well, you accept it though, and you're getting paid more. So, you guys are just greedy.
yeah.
It's pathetic.
All right. Well, if you want if you become even an individual customer of Claim Links, Tom will set up your healthcare or his team. But also, if once you become part of the family, he would do negotiating for you too.
Yeah, I could have some people on who I have, but I don't really want people to tell their sad stories. I can tell it without naming them. Much better way to do, in my opinion, to
But if
do
they
it.
but they say how amazing Claim Links is, that's a good thing, Tom.
Well, I mean, where I golf in Maine, trust me, my first couple beers generally are free.
Mhm.
Um, and when I walk into bars in Loveland, Ohio, most of my first drinks are free because there's people there I've helped. I've helped them get their kids' wrist that was broken, paying nothing at Children's Hospital, or having people who retired showing them how to layer their investments so they pay nothing for health insurance because of the Affordable Care Act subsidies. There's all kinds of things I've done for the folks, both liberal and conservative, I might add. I don't care what your politics are, I'll help you. So
You'll be
I'm
there.
all about love.
You'll be there for them.
I may not agree with them, but I'll help because I'm trying to help people. That's the goal here, helping people. That's why we work on what we save.
All right. Go to claimlinks.com. Schedule a call with Tom today. Appreciate it, Tom. That
Thank
was
you.
a special simulcast on the Neil Haley Show and the Cutting Edge Benefits Podcast, guys.